Vagus nerve dysfunction also can be termed as a sympathetic dominance or an insufficiency of the vagus nerve. Parents, if you've been researching ways to help your child, you've probably heard about the vagus nerve. Quite literally, it's probably the most popular topic right now when it comes to children's health. So in this video, we're going to dive heavy into that. If you are a parent of kiddos that are dealing with multiple health challenges and you just have this gut feeling that something is related to their nervous system, the vagus nerve, and you want to dive deeper, we're going to spend some time here really talking about what the vagus nerve is, what it does, because I want you to understand, for your sake, what exactly this is and why it's so important. Some ADHD, anxiety, asthma, allergies, colic, reflux, constipation, sensory issues, headaches, exhaustion, gastroparesis, emotional dysregulation. And like I said, that's the short list of different things that have been associated with vagus nerve dysfunction. Because we talk about this big term dysautonomia, which is the root of vagus nerve dysfunction. And what's really happening is it's an imbalance. In either case, what we are going to see is a child that is having major struggles, whether it's gut struggles, whether it's immune struggles, or whether it's neuro-emotional struggles. All of these things are going to be directly associated with poor function of the vagus nerve, because the vagus nerve's job is big. And it's not just covering one specific region, but researchers have shown that the vagus nerve is quite literally the most important nerve in the entire body, because it regulates the body from the inside out. It helps us to be able to control our emotions. There's problems with constipation, or, in some cases it's diarrhea, or sometimes it's reflux, or sometimes it's vomiting disorders. But when it's not, the consequences are so big, as we talked about before, that they're going to carry over into every aspect of a child's life. Now, I do ask, if the information that we're providing here is valuable, I would really love it if you could share this with another parent before we really get much further, because quite honestly, moms and dads, I do this work first and foremost as a parent, because I watched my own daughter struggle mightily for 4.5 years with, all of this stuff, right? It was now, moms and dads, what I want you to understand is that there are so many different things that are happening inside of our children. She was dealing with a torticollis because she had a very traumatic labor and delivery, which we'll dig into here in a moment.